Okay, so we have discussed the preventable means. Okay, so as Dr. Metmani has discussed as well. So of the unpreventable cancers, what are the greatest risk factors? And I think we've discussed that in some detail. So let's state the facts. So we discussed facts and myths, and we debunked, refuted those myths. Let's talk about the facts. The fact is that Caribbean and African American men are 60% more likely to be diagnosed with prostate cancer. We're diagnosed at a younger age, we have more aggressive disease, and we certainly are twice as likely to die of prostate cancer than our Caucasian counterparts. Age, as was mentioned before, is a risk factor that is immutable. As you stated, we cannot change that. Okay, 1 in 6 men will be diagnosed with prostate cancer in their lifetime, and Black men 1 in 7 to 8. The incidence of prostate cancer increases over 50 years. Over 65 years old, 6 in 10 cases of prostate cancer are diagnosed. And this is pretty similar to breast cancer as well. As you increase in age, 1 in 8 women will be diagnosed with breast cancer in their lifetime. Family history is certainly a predictive factor as well. The risk of prostate cancer increases 2 to 3 times more if a first-degree relative has been diagnosed with prostate cancer. The risk is further increased if you have a first-degree relative who was diagnosed with prostate cancer at an age younger than 50. And if you have 3 or more relatives diagnosed with prostate cancer, then you are even more increased risk of being diagnosed with prostate cancer as well. Genetics plays a role, and I think that was touched upon. Most patients do not know that BRCA1 and BRCA2 gene is not only affiliated or associated with breast cancer, but it is also associated with the diagnosis of prostate cancer as well. Other genetic syndromes, and I think that my colleague, Dr. Kigunda, will speak about this. Other genetic syndromes, such as Lynch syndrome, is linked to the increased risk of prostate cancer, not just colon cancer. And so when we talk about the preventable, so there are 2 categories. They're mutable and there are immutable. So the ones we can change, the ones we cannot change. So in summary, we can definitely change our body habitus. The way we do that is we change our diet, okay? So in my practice, we have waiting rooms that are close to our radiation machine. So we do not use the word obese. We do not use the word, overweight or fat, because there are family members actually waiting to see their patients treated, and then they're escorted. So we use the word corpulent. It's a euphemism, okay? So we can change, it's past, we don't say they died, we say they passed away. That's a euphemism for death. So corpulent is a euphemism for overweight, morbidly obese, okay?